Describe what goes through your mind when you initially see a patient.
I mean, the first thing and the most important thing is first listening to what the patient has to say first. Really kind of understanding what type of patient this is. How much does this patient really understand about what they are interested in? There are some people who, as you said, are very specific about what they want. And these days, patients are, on the most part, very informed. They have done their research. Listen, when you're actually going to come in and you're speaking with a plastic surgeon, it's not something that they are doing in a whim. They really thought about it twice, maybe even longer, and it's a true investment in their part, both in terms of their time as well as that sort of that anxiety that kind of builds up.
And one of the things that I like to remind people, both the patients that we see and the people that we work with, is our job is to remove the obstructions. People come in and obviously this is concerning to them. It takes a lot to jump that hurdle to actually show up to a plastic surgeon's office after you've looked at yourself in the mirror enough and finally gotten to the point of where, wait a minute, I'm concerned enough that I need to go to change something. Whether it's because you want to enhance something or because of aging.
Right.
And I think that's one of the big things is our job is to remove obstructions.
And act as a guide.
Absolutely.
You can't conform patients to the way that you think.
Absolutely.
Right? Because honestly, the patients know themselves the best.
And so, meaning that you've got to specifically address the things that bother them the most. There's an interesting idea about symptom amplification and the idea that people, when they're evaluating themselves, even though somebody else may be looking at their face, they're like, oh, that doesn't really bother me that much about you. Mm-hmm. But to that patient, how do they regard it?
Sure, absolutely.
They see it as a much bigger thing. And it's like, maybe it's a small mole, maybe it's that their ears stick out a little bit, maybe it's that they have jowling. But patients come in and talk to us.
And it is utmost importance to really understand what the patient really is looking for and the basis for the improvement that they're looking for.